Good evening, and thank you for joining me. I'm Joe Carbonetta, and this is Arroyo Live. Produced by and through the facilities of Pasadena Media, the purpose of our program is to help foster understanding and inspire a sense of community through informative and meaningful conversation. This program is live if you are watching on Tuesday, December 1st, and you can share your comments and questions with us anytime at arroyolive@pasadenamedia.org. With coronavirus cases surging across the nation, hospital beds filling rapidly, medical experts fearing the worst is yet to come, and Governor Gavin Newsom threatening sweeping new stay-at-home orders, this evening we once again look at how COVID-19 is affecting our everyday life. I'm joined by Dr. Matt Feaster, an epidemiologist and community health planner for the city of Pasadena, and Dr. Ying-Ying Goh, a pediatrician and the director of the Pasadena Public Health Department. Thank you both for joining me tonight, and we really appreciate your being here. I'd like to ask each of you to take just a moment or two to tell our viewers at home a little bit more about yourselves. Dr. Feaster, if you wouldn't mind, let's begin with you.
Yeah, no, thank you, Joe. We're really grateful to have this opportunity to talk to the community. It's been a pleasure of mine to serve the Pasadena community for over 11 years. A little bit about myself, I actually started right before the 2009-10 H1N1 pandemic and have since served on the responses to several large-scale outbreaks, including the H1N1 pandemic, like I mentioned, and now the COVID-19 pandemic. Before the pandemic started, though, I also worked in, as you mentioned, community health planning, community health needs assessments, and really any data that was needed from the Pasadena Public Health Department in the function of the epidemiologist.
All right, fantastic. And Dr. Goh, again, thank you for joining us this evening. Could you tell us a little bit more about yourself?
Sure, thank you for having us. And as Matt said, we're so grateful for any venue where we can help answer questions and clarify things in a very unclear time during this pandemic. So we're happy to be here. As you mentioned, I'm a pediatrician, and I have been working in public health for over 7 years now, and am the director and health officer for the department. What that means, not a lot of people know what a health officer is. I think they know now, but before the pandemic, it wasn't necessarily obvious or common knowledge. And so in California, there are 61 public health jurisdictions. Most of them are counties. There are 3 cities, Pasadena, Berkeley, and Long Beach. And our health department has been around for over 128 years. And we have to have, by state code, a medical doctor who is a health officer. And in the position of health officer come certain legal authorities that are, again, codified, written in law, that allow us to do things that are in the public health interest. Two of those things that now people are really familiar with is issuing isolation and quarantine orders for the control of communicable diseases, in this case, COVID. But in regular times, we do that frequently for tuberculosis, for measles. There are many different conditions where we might have to work with somebody who has an infectious disease to make sure that it doesn't spread to others. So, so that's my role.
All right. Well, it sounds like you are definitely the experts that we need to be speaking with this evening. And again, we really appreciate having you both here. You know, there are a million questions, and I guess the one to lead off with is that, especially in the media these days, we are hearing an awful lot about the severity of COVID, not only here in California or even in Southern California, but across the country, and even globally, if, you know, we broaden our scope quite a bit. But bringing it again closer to local, here in the state of California, we just had 9 more counties moved into the purple tier, which is the highest tier. And so it is getting to be a more severe situation all the time. And yet, at the same time, we are still hearing from people who are downplaying the situation, including members of the current administration, suggesting that it might not be as bad as some of the media would paint it. So I'd like to take this opportunity to ask both of you to give us sort of the year in review and tell us where we are right now.
I can start, and Matt, I can hand off to you. We first learned at the end of last December, so a little less than a year ago, about a novel virus that was causing severe respiratory disease in China. And there was a cluster of cases, and that was put on our alert because all around the world, we track and follow news about emerging diseases. And it was really an amazing feat of technology that within a week or two, they sequenced the whole genome for this virus. They identified it as a coronavirus, but we just didn't know really much about it, and we're all following it. We did not predict at that time that we'd see this situation that we're seeing in the United States, but really due to a sequence of events that has not been effective in containing and controlling this virus, unfortunately. But for us, what it meant was early in January, there were many of our Pasadena residents, our community members, who had traveled to China as tourists or to visit family members and were coming home to Pasadena. And there were questions at that time about restrictions, who should be on quarantine, if they were symptomatic, what would we need to do. And so at that time we were getting information from the CDC about those travelers, and we'd reach out to them and see how they're feeling and ask them to maintain quarantine at home. And so we're busy with those activities. It quickly, as the virus spread around the world, and given the amount of travel that happens in our modern world, was introduced to the United States at a couple different places: Seattle, Northern California, and then on the East Coast rapidly from Italy and from Europe. And we entered into a situation in March where we had to declare a public health emergency, and then in late March, a stay-at-home order or safer-at-home order. That was really, to me, the opportunity for us to go down a path of some other countries we've seen, like New Zealand, South Korea, Taiwan, and even Australia, who have really been able to, even with free societies, been able to, through consistent messaging and federal leadership, control the disease, contain the spread, and address outbreaks when they do happen, and then have their economies sustained, recover, and do quite well. And that's not what we're seeing here. And so that's what needs to happen. Going forward, I think just going through the next steps of what happened, in July, we had a huge surge in cases. We had really had to implement some more orders to close down after we had started reopening. And we saw that our community was able to bring that surge back down to a really low in September. And that's what we're realizing now as we see this new surge, what we need to do. And I know that we can do it because we've done it before, but it does require recognition from everyone that even though we're tired of the virus, we're tired of the restrictions, we're resentful, that the only way to beat it and to open our businesses and schools more and other activities more is by tamping it back down and by restricting the kind of interactions we have, social interactions that we have that lead to disease spread. So that's kind of a summary of where we are. And then Matt, maybe you have something to add.
I just am so grateful for Dr. Goh's timeline because it's much better than anything I could have done. But one thing I like to tell my own family members, friends, of course, virtually, whom I haven't seen in person for so long, is that this is not the flu. It is not the standard cold that circulates. This is a very serious disease. And in the beginning of the timeline, when people were exercising the safer at home order, particularly in those low points Dr. Goh pointed out, where we are averaging about 3 cases a day on a 7-day average, we are now well over that. We're at about above 40 cases per day, 7-day average, which is a huge case burden. This is not something we would typically see on a normal flu year. Another thing I would like to express so that people can really take this home and see that this really is a serious disease is on any one flu year, I typically view all of the death certificates for flu deaths, and we'll see sometimes on a slow year 3 or 4, and then up to a few above a dozen. We are now over 120 deaths, and certainly these are hitting people Our seniors the hardest, people who are living in long-term care facilities, and people with underlying health conditions, but young, healthy people are also getting this disease. And we're seeing it right now hitting families very hard, where someone will introduce into the household. And so, right now in this new timeline, you asked sort of where are we? We are seeing huge widespread community transmission, and it's really, really important that now is the time for our community to buckle down again and do their part to protect themselves, but most importantly, their family members.
And now we're going to get to this question, so we might as well address it now. With this, where is the evidence that we're seeing transmission in this setting or that setting? And the fact of the matter is that we're seeing it in every setting. We're seeing cases everywhere because of the widespread nature of where we are right now. So our evidence shows, there's data to show that wherever people get together, whether it's outdoor or indoor, or at a public venue or a store, wherever, or at a private residence, disease transmission can happen when you're close to somebody else, within 6 feet, especially when you're not wearing face coverings, and it's just everywhere right now.
Well, Dr. Feaster, I noticed that you did stress that this is not the flu. It is certainly something completely different. One of the things that seems to have inspired a lot of the I guess lack of concern in certain groups of people is the randomness with which the disease seems to affect any individual or group. Some people have extremely severe symptoms. Obviously, some people have succumbed to those symptoms, and others have reported not having anything worse than a runny nose if they manifest a symptom at all. I'm wondering if you both could speak to that. Are there certain factors that are more likely to cause a severe infection? Is it simply chance? Are there things that people can do besides simply wearing a mask and social distancing? Are there other things that can be done to help lessen the severity if one is infected?
Well, maybe I could speak to the clinical courses we're seeing among people in typical numbers, and then I can sort of break those groups, and then maybe Dr. Goh can talk some of those mitigating factors or underlying risk conditions that are causing people to have more severe illness. But in general, when we call people, there's sort of 4 big buckets. And certainly this disease may seem random, but when you start looking at the stats, you start seeing who these people are. So the first group are a surprisingly large amount of people who are asymptomatic or very mildly symptomatic, which means they might have very either a total absence of symptoms or very mild symptoms like a headache or just feeling really tired on a certain day. What we see with this group, and it tends to be a quite large group, about 25 to 30% of our cases, sometimes up to 50, but usually those people are younger, healthier, and when we call them, they're generally a little annoyed that we're even calling them about a case investigation, or they may doubt their test being positive because they're feeling perfectly healthy. But what we know about this group is, one, if they have a positive molecular assay test, then we know that they do have the disease and still have the capability of spreading the disease. And so this is a particularly pernicious group because what we're worried about are people having the perception that they're healthy, going out and taking the disease with them and spreading it to other people. The second group of people are the most typical, so this is the majority of the group. They'll have a mild to severe flu-like illness, and this typically lasts for about a week. And this typically has, body aches, fever. Most of the cases will report extreme tiredness, so they're staying home. In this group, we're less concerned about spreading the disease to other people because they can't get out of bed. They're very, very tired. And this disease can then linger on afterwards, where they'll start developing pneumonia, shortness of breath, or other respiratory illness. And a smaller group within that population, this is the third bucket, will then require additional medical support, acute care support at our hospitals. These are people who will then be admitted into the hospital requiring something like intubation or a ventilator unit. in the intensive care unit. And that's what we're really worried about right now, because we know if we have a surge, a significant portion of those people will then require that additional acute care. The fourth group are the ones that have the most severe illness, and certainly they're the ones that have the most underlying health conditions. And those are the ones at highest risk for death, although we do see some with this acute syndrome where they die suddenly of COVID, but that's the significant minority. So those are sort of what we see when we do case interviews or work with physicians who are attending to these patients. I don't know, Dr. Goh, did you have something to add?
So I wanted to mention that middle group, the people who are sick at home, the risk there is spreading it to the entire household. And there are steps that you can take to prevent that from happening, and you should take to protect other people who you're living with, but also that can result in much broader spread in the community if the entire household gets it. So, so just to mention that. The risk factors for worse outcome include, of course, older age. The risks go up as you go up in age. There's not really a strict cutoff, even though we often say age 65. It goes up from age 40 by decade. It will go up. And people with underlying health conditions such as hypertension, obesity, diabetes, asthma, any heart conditions. So a lot of people, I mean, these are very common conditions that that we have, especially as we get older. So those are you know, those are serious concerns for, and should be really taken into consideration when you think about your activity, like whether it's getting together for Thanksgiving or for that baby shower or whatever it is. If you fall into one of these categories, we really, really advise you for your own good to not partake in that gathering. And actually, given the surge, we are issuing new orders tomorrow that will be in line with also what LA County just issued on Monday about limiting and restricting gathering further, which is that people are not to have social gatherings with other households for a couple weeks, for about 3 weeks, as this order is in effect for now. And of course, it can change depending on how things go. But we are asking people to refrain from getting together with people from other households. There are exceptions, and the exception is if you're an essential worker and you're doing an essential work activity, then you can continue. And there are allowances for going out to our retail establishments with all the protocols in place. It does include outdoor dining, but only with your own household. So at one table at an outdoor dining venue, you cannot mix with other people. That now is not the time for parties. We have to address the surge, and so we're going to try and get a hold of that.
All right. Well, Dr. Goh, you just mentioned the outdoor dining, and that brings up an interesting situation and obviously some questions there. As we noted at the top of the show, there are a great number of communities here in the state of California that have been moved to the purple tier, which is the most restrictive tier when it comes to social distancing. In fact, it's just about a stay-at-home order. And so most counties have, and most cities have bans now on outdoor assemblies and up to and including dining out. However, Pasadena has sort of bucked that trend. Certainly they have their own health department and they can choose to make their own rules. But is that the wisest course of action given the current status of the virus and the fact that it is spreading? I was wondering if you both could take a few moments to talk about that.
So let me provide the accurate characterization of the situation. There are 51 counties, last time I checked, and local health jurisdictions in the purple tier, which is widespread disease transmission. As we said, the rates are through the roof, and we need to not only adhere to the restrictions that the state has put in place, which we are all subject to. So we are following every restriction for the jurisdictions in the purple tier. But we are also putting in place extra restrictions. And those extra restrictions, as I mentioned, includes the prohibition on gathering, that's new, and also asking for reduced capacity at the venues that are allowed to operate. But in addition, because we are a smaller jurisdiction, our city has mobilized significant resources just in the past week to redouble our efforts on enforcement. We have staff from every city department going out to ensure that protocols for outdoor dining are followed. Every single line in the protocol of many, many pages is followed, including protection of workers. So they have to wear face shields and face coverings if they are serving diners, because diners don't have face coverings on when they're eating. They're at higher risk. And also all the physical distancing. The spacing of tables is from person to person, not from table to table. So they're essentially about 8 feet apart at least. And so the people can be 6 feet apart. And everyone has to keep their face coverings on at all times except when they're eating or drinking. And they cannot be, once they get up from their table, then the face coverings need to be on. And we have done enforcement. We've done education and outreach to our restaurants. This is in an effort to support them, of course, through this, without introducing additional risk and reducing risk. So our enforcement efforts are trying to reduce whatever risk of spread may have been there. And we know the rules of COVID pretty well now. We know that what stops transmission. So that's what we're ensuring is in place. And that that people are not coming to Pasadena to mix with other households, because that's not allowed. Restaurants are going to post and let people know that it's one household per table, because you can't be 6 feet apart. The state order requires people who are gathering to be 6 feet apart from each other at all times. And at a dining table with your masks off, sitting with people from other households, you're not 6 feet apart. So that doesn't work under the state order. And so our orders are combined with our enforcement efforts are everything that we can throw at trying to flatten this curve.
But is there any concern that, especially since it has been widely publicized in the media, that the city of Pasadena is continuing to allow the outdoor dining, that it's going to attract people, citizens from other communities where the virus is currently more widespread? There is no concern that they may, in fact, bring that virus into Pasadena, which has traditionally had lower occurrences to date.
That's actually not true. Unfortunately, our rates are equally high as that of the county, and our positivity rates and case rates. And so it's, as we said, it's everywhere, and there is no line around the city. We are concerned about people coming here. That's why we're messaging and requiring our restaurants to control the crowds. If we see that crowds are a problem, then we may have to change our orders and create more restrictions. But also they're implementing reservation systems, because they can't handle more than their capacity, and they're doing what they can to try and reduce what you described from happening.
Okay. Well, moving on, let's talk about the holidays. We just got past one. Obviously, the Thanksgiving holiday is now in the rearview mirror, but Christmas is squarely in our sights, and beyond that is New Year's. What concerns do those holidays bring, especially since traditionally that is a time that families do come together?
It is a trend we have seen time and time again this year. Every time there is a holiday where people traditionally get together, 2 to 3 weeks afterward, we see a big surge. It is compounded if you have multiple holidays stacked against each other, and that's really sort of what we're most worried about with Christmas. We know during Thanksgiving and Christmas, people are more likely to travel, which means they're mixing with different familial units. So maybe it's still part of the same extended family, but different households. We're concerned that we saw huge increases after Thanksgiving, and what that ends up doing is those people then take it home to the next round of people who are eligible to get the disease. And so certainly we are using this time as much as we possibly can to remind people this is the year to stay home, do virtual celebrations, shop online, do whatever you can to create that space, wear your face covering if you have to go outside, only do essential work if you can. This is really the time to focus on what efforts you can do to prevent community transmission as we move toward the Christmas season and other holiday season.
And it's particularly because of where we are right now. this 3-week period is crucial. We can go two ways. We can go up, see the cases keep going up and overwhelm our healthcare system and put all of our well-being at risk, or we can act now and turn the curve downward. And so it's really all of our choices, collectively and individually, that will make a difference. It's so sad that a holiday celebration, what usually is a celebration, can lead to tragedy. And it not only impacts your own immediate family, and we've had so many stories of people that we've talked to with tragic stories about losing loved ones, family members, as a result of a party, what's supposed to be a happy situation.
Yeah, we had similar, like, so I want to say we had a Father's Day celebration where someone brought it to their father who passed away. We've seen it in other holiday celebrations where someone knew that they had the disease, brought it home, and then a family member passed away a few weeks later. It's tragic to see it happening, and really want to discourage that.
And it really has been hard. We talk about how hard it is for frontline healthcare workers, certainly as they try and treat patients and they lose patients, and they see people suffering, even if they survive. They suffer, and we've heard of long haulers who suffer with symptoms for a long, long time, arthritis and shortness of breath, and we don't even know yet what the long-term consequences are. But even for our public health department, really, these are real people. They're not numbers to us, and we really we just want to protect our community because we've seen the damage that this virus does. Yeah, so.
Well, as you both have noted, certainly it is a very difficult time for many, many individuals because the Christmas holiday, this particular season generally means family and get-togethers. Is there a safe way for families to come together? Are there things that can be done to lessen the risk? Or are we really just forced to stay apart and do everything via the computer?
So when we can get our case numbers down, we have more options because we know some ways to reduce risk. The number one way to reduce risk is get our community case rates down. If we can pause for 3 weeks or a couple weeks and get the numbers back down to where we were in September, then we can, with fairly low risk, get together with 1 or 2 other families outdoors for shorter periods of time, wearing face coverings, staying separated, and interact and have social interactions. That's not normal, but it's much better than just Zoom, as you mentioned, just remote. So I think that it's just where we are right now is not a place where we can really even have those limited gatherings right now. We want to just get the risk down as much as possible so that we can get back to a better place for our businesses and for our, friends and family. And then in 6 months from now, hopefully, we'll have some other options as far as getting immunity through vaccine for the general public.
Dr. Feaster, I saw you nodding in agreement. I was wondering if you had anything you wanted to add to that.
I mean, how do you top perfection? That was great. I think the biggest thing for us is this is the time. We've got 3 weeks, really time to buckle down, and we are not seeing that in our case interviews. When we're calling people, there are plenty of people who are disclosing, I had a party, I went to a large Thanksgiving gathering, I went to a baby shower. So we do know that, there are still a good amount of people who are not refraining from these large social gatherings. And so this is really an important note for our public to hear, which is please stay home.
Well, so it's not just individual responsibility. So, as public health, we try to create the conditions that will be conducive to everyone's best interest, but also for employers to provide options for people. We have talked to cases who have gone to work sick, knowing, or even with a positive COVID diagnosis, because they've got, there are certain pressures that are leading them to make those choices. Either it's the income, they can't sustain the loss in income, or they don't have an environment that is providing the positive reinforcement to take care of yourself and take care of others as well. And so it's all of our responsibilities together to create the environments that that help us make the safer choice.
Yeah, we do have a whole worksite team dedicated to working with our employers and our essential workers to provide as safe an environment as baseline can be, and also to provide feedback to our employers on how to better provide a safe environment that isn't about outbreak investigations or case investigations. And so we would like to remind the public that we are here for questions as well.
You know, on the broader level, I think that our state government, our federal government really knows that in order for people to be able to stay at home and restrict their activities, there is the need for some financial resources. So there is definitely a need for stimulus to provide support to those people who can't work, particularly during this time when we need to have more restrictions.
Okay. I'd like to take a moment to talk a little bit about healthcare resources. There is increasing concern about us overwhelming the healthcare situation in our country, especially as this virus continues to surge and the holidays fast approaching. But it's really not, or at least it's more than just a concern over space. I was hoping the two of you could speak a little bit about that.
So as we've had more and more demand for healthcare workers around the country, they've gone to where they're needed. And as the other places surged before us, we're facing a very real shortage. This is what our hospitals are telling us and what we're seeing statewide. A real shortage of healthcare workforce, and if they get sick, then that shortage even increases. So we need to protect them by keeping COVID rates low, but also our system will be quickly overwhelmed because we can't staff enough beds. We can have actual physical beds, but that doesn't provide you the care that you need in the hospital. You need the people to take care of you. So that's a very real problem, and the county-wide healthcare system, which includes in Pasadena, we've seen steep, really rapid increases in the rate of hospitalizations, and we know what's going to happen because we know that when there's going to be a surge, probably from Thanksgiving. We're waiting for it, or I mean, it's already here, but we're expecting another bump up, and we know that about 12% of people who become sick with COVID get hospitalized. So you can just extrapolate the numbers. Every day today I think in LA County we had over 7,000 new cases, including our Pasadena cases. And so 12% of that will result in hospitalizations a week or two later. And day after day, if we're averaging over 5,000 in the county, then we're just quickly going to overwhelm our healthcare system. And as I mentioned, it's not just healthcare staff to take care of people with COVID. It's healthcare staff to take care of me if I'm in a car accident, or if I trip and fall and need some care, sprained ankle, or if someone has a heart attack. That happens every day. We need to preserve that healthcare resource.
And again, Dr. Feaster, I see you nodding in agreement, but nothing that you'd like to add to this either.
No, just that I'm a numbers person, so I see the surge happening. I mentioned we went from 3 cases a day on average in October to more than 40. And if you're playing that odds with about 12% of those people each day in Pasadena is going to be redirected to our acute care hospital, you can imagine those people are not going in and out. They're being inpatiented on average between 3 to 7 days. That starts to accumulate, and then we exhaust our resources very quickly. And so what we're trying to do is, we're back to that old turn of phrase, flatten the curve, by staying home, by doing all the prevention messages that Dr. Goh talked about. We can help prevent that sort of surge onto our very desperately needed acute care hospital.
I want to address some very logical thinking that folks have had about, well, there's a certain amount of activity I've been doing and I've been fine. I haven't gotten COVID, even though I've been getting together with, my friends every Friday night or Saturday night. And this is not what I've done. I have not done that. But people are thinking that it's still okay. And the problem is that the risk of any of those people that you get together with with case rates this high in the community, goes up. And before, when case rates were low in the community, your risk of encountering somebody during one of the social interactions who was infectious with COVID was lower. So the same activity now is riskier than it was before.
The other thing I keep hearing too from the community when we're doing the interviews is, well, I only hung out with, my roommate or my partner and then one other friend. And then when we do the interview, we find out, well, that other friend actually hung out with 10 people at a party. And so what I'm trying to say is your risk circle is much larger than you think as well. So to Dr. Goh's point, which is you may in the past, because we had low community transmission, been able to do some activities and did not see the effects of COVID transmission in your own social circle. But as you meet other people, you increase your social circles, the community transmission is so high, the likelihood of getting a COVID case is much, much more elevated than it was ever before. And so it's just really sobering to remind people that the risk is real.
Well, over the summer months, we certainly did see a decline in the infection rate for COVID. And it gave the appearance that perhaps the infections were more under control. And of course, that inevitably led to discussions about even in limited capacities reopening some of the schools in the fall when the school season began. Of course, that also brought the winter months and the beginnings of the surge that we're now seeing. What would you say to those parents that still seem to be upset and pushing back on the idea that schools remain closed, and their argument that the cost to the children in not being able to socially interact is greater than the cost of them risking infection?
Well, fortunately, we were able to start the process of opening schools. It's a significant investment because we want them to be successful and we want them to be able to provide that education and social interaction to children while keeping all of the children and the children's family members safe, and also or as safe as possible, but also the teachers and administrators who are there taking care of them. So we have at least about 16 schools in Pasadena with limited services on campus right now in person, and many of them, I don't have the exact number on hand, it's on our website, you can see it on a dashboard, have applied for school waivers, which allows them to start opening their transitional kindergarten to second grades. We were planning to expand to third through sixth grade, and the state doesn't allow high school to be open at this time in the purple tier. But we were hoping to, progress and do that. And what we've been doing is working with schools to provide technical assistance and really educating them and helping them take on that enormous task of restarting an operation in a completely different way than they had before. And many of these schools are trying to offer both in-person and remote learning. So they're doing twice as much work, 2 different venues. And it's extremely resource intensive and challenging. And so to the extent that we can help them with understanding how COVID works and what they need to do to be able to be prepared, we've been doing that. And we're so, yesterday and today, I visited some of the schools that are open, and we're so grateful to them and to the families and to the students, really 5 and 6 year olds who are wearing their masks really well, who are choosing to sit on the tape for lunch at the table separate from other kids, each at their own individual table, who are keeping distance when they're walking in line. And so we are really, really thrilled to see that happening. The new order does not close schools. So at this time, we are not stopping that from happening because they've really implemented the protocols. And we know that there will be people coming on campus with COVID. And so we've helped to prepare them to know what to do when that happens, and trying to keep the risk of that person with COVID from spreading it to others by staying really in compliance with all of the protocols, the very, very best that they can. People aren't perfect, we're all human, and transmission can happen, but just to keep the likelihood as low as possible.
Yeah, we've had a lot of lessons learned working with our daycares, preschools that have operated, working with doing other outbreak investigations. We have a lot of lessons learned that we can apply to when we start opening schools and doing these, really tailoring our prevention messages so that they can work, and so we can do in-school instruction as safe as possible. And so one thing I will say that comes up a lot when we talk with parents is there's an assumption that kids can't get it or spread it. I can tell you, yes, they are very efficient germ spreaders, especially COVID, and we do get kids with cases, and it can be very serious. I'm sure we'll talk about it a little bit later, but kids are very efficient at getting and giving SARS coronavirus 2, which causes COVID-19.
And so we have seen outbreaks in childcare settings, and I'm actually surprised when we don't, but we have seen them in many childcare facilities, and it's increasing now because there are increased community rates. So more and more people are bringing it into any setting where people get together, including children.
Another thing that seems to affect, and I don't want to, I hesitate to use the term uniquely, but we have seen it mostly in children, is something related to COVID called multisystem inflammatory syndrome. Would you take a moment to tell everyone a little bit about that?
So multisystem inflammatory syndrome is a condition that's seen in children. It's defined as a condition in children, but it has been observed in adults as well. It's called MISC, and multiple organ systems become inflamed, and they become very ill and need to be hospitalized. And it's extremely rare. It really is not common, but it's been observed over 100. Actually, I don't know what the number is now in the nationwide, several hundred, I believe, children, and it's associated with COVID. So kids who have a current COVID infection or have a history of a COVID infection recently, and they often have problems with their hearts, their kidneys, multiple symptoms or systems. We have not had, we've had one confirmed case in Pasadena, but we haven't had a death. And I think that LA County hasn't had a death in a child with MISC either. So that's fortunate. Matt, you might have more to add about.
No, just that the MISC is extraordinarily rare. We don't see it very often, and it is really hard to diagnose. And so when we do our investigations, we're always very judicious about looking into that. And the only reason why we bring it up and talk about it in public is because it is a very serious condition and is associated with children. And we want to debunk the thought that children can't have very serious reactions to this disease. It's not always asymptomatic, and it can be very scary for a parent.
Okay, well, speaking of symptoms, what are the basic symptoms that one can expect to see if they become infected with the coronavirus, and what is the next logical course of action?
Well, so 20 to 40%. So this virus is brilliant. I mean, it doesn't have a brain, but its characteristics are such that it has been able to cause this kind of widespread damage all around the world, because one key attribute that makes it so effective is that 20 to 40% of people who have it, we think, are asymptomatic. So they spread it without knowing that they're sick. So you could have no symptoms. But as we also know on the other end of the spectrum is that people die from this, and people can die very suddenly without really, we've seen it without having very many symptoms, and then it's fatal. And then in between, I think Matt already described some of the symptoms, which are fever, cough, shortness of breath. The list, when you go on the CDC website, it's pretty much any symptom that you could imagine having is on that list of a symptom of COVID. The unique one that was really a hallmark in the beginning, where people thought it was odd, was the loss of taste and smell, which you don't usually get with other coronaviruses. So that's the kind of unique one. But vomiting, diarrhea, or nausea. Did I miss anything? Joint pain.
I was going to say that the sort of insider tip from interviewing over 3,000 people now is it's not always just a total loss of smell. It could be a change in taste or smell. And some people don't get it back, so we don't know. Some of them have lingering effects. Some have seen an irreparable change in what they liked before they had infection. It's been a very interesting sort of hallmark symptom, as Dr. Goh mentioned. Other interesting things are the GI, the gastrointestinal symptoms. What this disease does is once it invades a certain body system, so we talked about sort of multi-inflammatory system where it's attacking different organ systems. Once it gets into that area, that's sort of the symptom presentation that you see. And if you have an underlying health condition that sort of predisposes you to have something, then we sort of see a different symptom set. And so it's been, as you mentioned earlier, Joe, interesting to see how somebody can have absolutely zero symptoms or maybe just a loss of sense of taste or smell or a mild headache. So we have a lot of people, that's their first and only symptom, to somebody being bedridden for literally 7 days with the worst body aches they've ever seen. And so it's a very fascinating disease in that it has a broad symptom onset and a diverse clinical manifestation. So some people have very short clinical courses and some have very protracted. And so it's a fascinating disease that I'm sure will be studied for years.
And again, I think I posed this question earlier, but just to reinforce the point, it seems to not have any rhyme or reason for how it affects certain individuals. I mean, are there certain groups of people, the age and comorbidities notwithstanding, are there certain groups of people that are more susceptible to severe symptoms, or is it really just those circumstances, such as being overweight or having high blood pressure or things like that are the deciding factors?
Well, we've only had this virus around for 10 months now. And so there are a lot of hypotheses. There are a lot of things that people think, well, maybe it's this, maybe it's that. Initially we thought maybe it's the ACE receptors and maybe it was binding to those. And so people who had more of them, but we don't know for sure. But I think that there is an interesting idea about infectious dose. And that if you are in close proximity, let's say someone coughs directly on you, no one's wearing face coverings, and you get exposed a lot at once. There's a thought that maybe that would result in worse, like an overwhelming infection and an immediate, an immune response that's overwhelming that causes all these negative effects from COVID. Maybe that's linked to worse cases. And then if you have a lighter dose, so you're outdoors, you're wearing face coverings, you're far apart from people, you could get exposed and maybe you would not get as sick. So that's one of the hypotheses.
Okay, well, that's very interesting. And then obviously further study is going to be needed before there's any conclusive evidence one way or the other. Amazing how quickly the time goes by, and we're coming closer to the end of the program. Of course, I wanted to take a moment to talk about all of the discussion about vaccines that are coming and how effective they are and the implementation of those vaccines, who's going to get them first. Hopefully we can take the closing moments of the show and you can both discuss that a little more. I know our viewers at home are very interested to find out where we will be in the next 6 months.
Well, I think the first word is wow. It's amazing technology that we've been able to develop effective vaccines in such a short time. And there are so many in the pipeline. I think there's 16 in phase 3 already around the world. So the research and the development is active and ongoing, and we will all certainly benefit from that. There are a lot of issues, and Matt was on a call this morning with the committee, the CDC committee on immunization practices, that is going to be publishing tomorrow the vaccine prioritization that's recommended, and they're doing so with a lot of feedback from a lot of different communities, including public health, but also people from all different backgrounds on what the right prioritization is.
Yeah, I think Dr. Goh is absolutely right. It is incredible to think that we got a novel vaccine for a novel virus this fast and with this many, but that still doesn't mean that we're going to have enough doses for everybody right away. And so right now, there's a lot of people in the what we call the local public health system, which includes pharmacies, hospitals, long-term care facilities that include nursing facilities, and nursing agencies and large governing bodies about how do we get the dose to the people who need it the most fastest. And so that involves a lot of prioritization and input from different groups. And so just today, the biggest, the group met and they are finalizing the first round. And so we'll wait to see if this gets ratified. I think they were still signing it at the Centers for Disease Control and Prevention. But in general, it will be healthcare providers, long-term care facility residents, and other healthcare workers. And the idea is to get the people who are most at risk to get the disease and most at risk for severe disease first. And so just to let you know a little bit of history, this is not new to the health departments. We have been practicing for decades on how to deliver vaccines after a bioterrorism event or a mass pandemic. I mentioned my work with H1N1 where we delivered over 18,000 flu vaccines to the community, and then worked in close partnership with other healthcare providers to provide flu vaccines in that instance. And so we're doing the same thing. This is something we practice every year with our very experienced emergency preparedness team and nursing squad that go out, that deliver vaccine themselves, but also work with partners like our federally qualified health center, like ChapCare, Huntington Hospital, and other important local partners. And so what I can say is the CDC and our California Department of Public Health have been doing a really great job assessing the total scope of each of these priority groups, giving us an idea if doses were to come in, who should get it first, and working out a system of storage that can encumber these vaccines so that we can get them out as fast as possible. And so we've been doing, I should say, our emergency preparedness team, not me, they've been planning for this vaccine since the disease started becoming more widespread in July, August. They've been really identifying sites, how can we do this the fastest? And so this is not news to us. We are practicing it and really working hard to do that.
Okay.
I want to also mention about vaccine. I mean, we have a state committee of experts who will be scrutinizing the data to look at both the efficacy and safety of the vaccine. Sounds right now like the two leading candidates from Pfizer and Moderna are extremely effective, which is such good news. But they do require 2 doses, so that adds a complexity to making sure that people become immune to it. And then the really low, ultra cold storage is a problem for one of the vaccines where you have to keep it at negative 80 degrees Celsius. So I think that and we know that there are going to be new vaccine options, hopefully one that's just refrigerated, that might need only 1 dose. So I'm very optimistic, but also that we will absolutely be looking at the science to make sure that this is safe for people. And we will be transparent and convey all of that information so that you can have faith and trust that this is what's going to be the best for you and your family.
Well, Dr. Goh, I do certainly appreciate that you are reinforcing the point that efficacy and safety are the paramount concerns in the development of these vaccines. Certainly there have been questions about how safe they will be, and we've all heard the reports of Americans saying that they would not rush out to get the vaccine when it becomes available for fear or concern about its safety and its efficacy. But I wanted to touch on another topic of discussion, and that's the long-term expectations for these vaccines that are coming out. Are we looking at a permanent immunity, or is this likely to be something where once a year, along with our flu shot, we'll be getting a coronavirus vaccine?
If that's the case, hopefully they will be in one. I've told my children that because they asked me that exact question, are we going to have to get 2 shots every year when they got their flu shots this year? And then I said, well, hopefully it'll be in one if we need it. But we don't know the exact answer to that yet. Preliminarily, we haven't seen too much change yet, but from season to season, it's possible. I think coronaviruses, we don't typically see that much change, but I think we're in new territory. So that's to be determined.
Okay. And again, as you did mention, there is at least one vaccine that requires 2 shots, other vaccines that only require a single dose. And I believe that I recently heard that the vaccine that is slated for immediate dispensation here in California is going to be the 2-shot vaccine. So I guess in the short term, anybody that is going to be getting the vaccine will end up with more than 1 shot.
Yeah, and there will be a very limited number of healthcare workers. We won't even be able to get it to all our healthcare workers in the beginning.
Okay. Well, so obviously for the short term, still the most important thing that we can take away from this is the need to social distance, the need to wear your mask whenever you're in public, and just practice all of the safety precautions that have been conveyed over and over again up to this point.
You got it.
All right. Well, I think that brings us to the close of our show this evening. I would like to once again take this opportunity to thank you, Dr. Ying-Ying Goh and Dr. Matt Feaster, for your time and your expertise in this. I know our viewers at home really appreciate that, and wish you all the best and to stay safe. To our viewers at home, if there are topics you would like to see addressed in our discussions, you can email them to us at arroyolive@pasadenamedia.org, and we may include them in a future broadcast. This has been Arroyo Live. Thank you for watching. Good night, and please remember to stay safe and wear your mask.